Now we have the CEO, Occupational Health and Safety Management, IDEN, joining us now on Skype. Good morning. It's good to have you join us right now. If you go on social media, a lot of Nigerians have actually, aired their minds, their opinion regarding the health system that we have. If you recall, WHO has said that African countries, Nigeria inclusive, should be wary and should be very, very cautious and brace themselves because of the weak health system we have regarding the coronavirus. Now, what do you make of how we have invested or not invested in the health system over the time, let me say?
Good morning, Mike and Co, and it feels so good to be here again. Well, what we are seeing right now is revealing the investment that we had in our healthcare system, and which, of course, globally, the healthcare system in Africa has been tagged so fragile, and that was why everybody was looking at how do we avert or take early steps in ensuring that coronavirus does not invade us and our nakedness will get shown in the long run. We've talked about it severally on your station, that healthcare is not a priority to the Nigerian government. And that's why you see that very little percentage of the national budget is allocated to Nigerian healthcare system, which of course is less than 4%. And if you go back to the Abuja Declaration, where every country in Africa agreed that they should raise the budget to 2 digits, to be 15%. If only one country has done that, and most countries have even reduced their budget after that declaration. And this is coming to bear right now. It's just like the pie that you bake, then we feed you with it. And that's what we are having right now. Coronavirus is not discriminatory. It gets to us as anyone, irrespective of status in society, color or creed. But here we are right now. What we didn't prepare for, the healthcare system we didn't fix, we didn't give attention to. We have to be, how shameful it is that we have to be admitted in those healthcare sectors. I think it's even good. Let them be admitted there. Let them see the decay in those systems. Let them see where they can be admitted in the world, where they even have no ceiling fan, where they be admitted in a place where they can barely have side locker beside them. It is good. But I just hope, not just that when we go through this and we're out of this, that the lesson learned, we're able to go back to our drawing board.
And that's where I'll take my question from, Do you think that after this blows over, the government would do as much, pay as much attention, give the necessary finances needed to address or strengthen our health system?
If it is the same government you and I know, we can predict what will happen. They will not do anything. Once they survive this, everybody go back to their respective homes, their respective lifestyle, and start again. You were here when we had Ebola, and we thought after Ebola, at least we will be able to actually, step up the standard of Nigerian healthcare system. Ebola came and left, then we went back to our old style again. This has always been the style that is used in Nigeria, but that this is taking us on our way right now, meeting us in our naked state, is very pitiable. And I just pray that mortality that we suffer, if this case go beyond this, won't be too worse for us to comprehend.
All right. In the past few weeks, we've seen donations to Nigeria. Chinese richest man, Jack Ma, we've received some supplies from him as a country. The government of Japan has also sent in some finance, and there are pledges from different organizations, even World Bank and WHO, as the case may be. Now, some Nigerians are saying, please don't give us money, just give us health equipment and all of that. I wonder what you say about that.
I totally subscribe to that, knowing our people for who they are. I was reading through all the donations, what all people are putting. I saw yesterday to the Lomelu put up a lot of funds, and that was exactly what came to my mind. We have a pandemic here right now. People have shifted from living, and now they are thinking of survival. But most people, what we're looking at today is how much can we make? How can we exploit the system and amass wealth to ourselves? The funds they're bringing in, you understand the fact that when they bring in funds from developed countries into Nigeria, They don't supervise how these funds are being used. We don't need the funds. We need the medical equipment, because, I mean, don't be surprised that some people still put the medical equipment in their house after the outbreak. They go and put them. They go and sell them. But this is who we are as a people. We need medical equipment and the ways, not the funds, because people will make themselves rich by taking this fund to themselves, and the system that the funds have to cater for is still left unattended.
This time around, I want you to look at capacity, especially with regards to medical personnel and perhaps testing kits and everything required. Do you think with the increasing number of cases that we are recording, and remember that the government is still searching for about 4,000 persons, do you think we have the capacity to address this issue head on?
To be frank, we do not, in my estimation. Why am I reason for saying this? That when the healthcare system was going down by the day, healthcare professionals we had in Nigeria started leaving the country. They were going to support the systems of different countries across the world. Some were even going to South Africa to practice healthcare. But now we have this issue on ground. We don't have enough capacity. How many doctors do we have in the country? How many nurses do we have in the country? So these are the issues right now. If we knew we have 200 population, it would have been a priority of government to start saying how we can build capacity early enough. We do not need to wait for crisis to come to make us know that we have no capacity. It has been obvious from day one that we have no capacity to manage the situation. All the things that we need, like the medical equipment, we don't have. The one that we have, they are all dilapidated. So now we are just caught naked in our bedsuit and trusting God to help us. If you go to some hospitals, you can't even walk in. You can't find, functional blood pressure machine to check your blood pressure. Is it the same place you go into? Recently I heard there were only 200 ventilators in this country, and that was what I heard on the radio. And how do you have ventilators, only 200, to cater for 200 million population? And when you know that this is what you need to support those who have difficulties in breathing, which of course one of the features that comes with the coronavirus disease. So these are key issues that have caught us unaware.
All right, IDEN, thank you so much for talking to us on TVC Breakfast. Right now, CEO Occupational Health and Safety Management, IDEN, joins us now on Skype. Good morning, it's good to have you join us right now. We are where we are right now already, as a lot of times people will say. If we have to take this step towards changing the narrative in the health system in Nigeria, what should be the dimension now? Some say we need to build more hospital outlets. Others are saying we need to train more medical personnel. Others are saying it is the equipment that matters. Talk to us.
They are all connected. You cannot do one in isolation of others. One, we need to have more medical personnel trained. We need to have more medical personnel trained. We need to build more facilities. We need to increase the funding in healthcare. These are all connected. Not just that, we need to also see how we can put funds together in what you call healthcare research. We are not involved in medical research in Nigeria. Even if we are, the percentage we allocate to it is so minute. We need to start all these put together will help us profile diseases and infection before they break out, anticipate them, and be able to have a level of preparedness so that even if we are not able to withstand it, at least to a great degree, we're able to manage the outcome when it happens. And these we don't currently have. But above all this, we need healthcare infrastructure. It needs to be revamped. What we have currently in the country is a total write-off. We need healthcare infrastructure revamping or restructuring is very important. You have most facilities, there are no equipment. Equipment are obsolete. They are not functional. You can't blame doctors that are leaving the country because they want to stay in their country and work, but they don't have access to good equipment. So it's so frustrating. Just like you, Mike, you're a broadcaster. You want to put the best of your time into broadcasting, but you can't even come out audibly for people to hear you. You get frustrated, and this has led to
All right. All right. We lost that signal there from Ehi. But okay, I hear he is back now. Ehi, can you confirm if you're back? All right, fine. We have you back now. You were saying something.
I was saying that most healthcare professionals in Nigeria, they want to stay and work, but they don't have good infrastructure for where they can actually do their work. And we need that to be fixed first. I use you as an example. You're a broadcaster. You want the world to hear you, to talk on national issues or global issues. But when you cannot come out audibly, it becomes so frustrating. And this is where most healthcare professionals have found themselves in Nigeria. And you see them, when they get tired, they exit. And this has led to us having very low number of healthcare professionals in Nigeria. But we need to start training again and improve. Even the medical colleges need to be improved. I mean, the infrastructures, the curriculum needs to be reviewed even to meet the new world healthcare order.
All right, the president, during one of the statements he made at some point, he talked about building about 10,000 centers. Is that enough? How much of a difference will that make?
Well, if he has made that promise, let's encourage him to do that first. Because we don't even have enough. If he said he's going to build 10,000 centers, let's encourage him. At least that's the starting point. We will not be at the position we want to be in a matter of days, weeks, or years, owing to the level of neglect that the healthcare sector has suffered. If he has promised he's going to do that, let's encourage him to do that first. When we get there, we look at what do we need more, and at that point we chart a new course of what should be added to it. But let's take that as a promise he has made, and let's encourage him to make that happen so we know where we go from there.
All right. Thank you very much. We'll take one step at a time. Thank you, IDEN, for your time on TVC Breakfast.
Joining us via Skype is CEO Occupational Health, IDEN. Thank you for joining us on TVC Breakfast. Now, Nigerians are optimistic, or are hopeful, rather, if I may use the word, that after this pandemic, lessons will be learned, and within 12 months, they would see a change in the healthcare sector. But I'd like for you to paint a picture of what happens if there is no turnaround in the health sector, because some have said that if nothing is done, something worse than coronavirus might just cause a breakdown in the system.
Well, I also hope that if we overcome this phase, the lesson learned will be used to build the Nigerian healthcare sector. That is just what we feel, but most times what ends up coming up is not what we anticipate. Because we have several issues before, and we expected, some reactions from the government afterwards, but nothing happened. But the truth is, if nothing is done, the pace at which we are going, we may have a total decay of the Nigerian healthcare sector, because we are characterized with diverse outbreak of infections within the geographical region where we are located. We have monkeypox, we have meningitis, we had Ebola and Lassa fever, and these all come in quick successions. But all this put together would have been, we would have thought that looking at all these outbreaks, that Nigeria should be prepared enough to manage, more outbreaks as they come. But with the outbreak of this coronavirus right now, it further reveals, how unprepared that we are. We need to really rejig the system entirely. I don't really know what exactly it is. If it means going back to review the curriculum of healthcare training centers, if it really fits into the new reality, we need to. Because if you look at it really, what we taught, what the models we used in 1971 cannot fit into what happened in the world today. Then we didn't have such a strong technology.
All right, so let me interrupt you a little because of time. The point there is, in all of this, in changing things and what Nigerians expect to meet up the standards and the 21st century, the critical thing there, the most critical thing there is the issue of fund. And the government has always talked about the paucity of fund. Now, how challenging would it be, considering the reality of how funds are not readily available, to tackling the issues of health in Nigeria?
The first point we should look at, really, Mike, is we should implement the Abuja Convention. I mean, in that convention, we all agree, we signed into it that 50%, minimum of 15% should be the allocation that we should have from national budget. We need to step this up because every government that have come always play down on health, two things, health and education. And these are two critical sectors in Nigerian growth and economic buoyancy. We need to look at that because we cannot remain on less than 4% budgetary allocation to Nigerian healthcare system, and we expect the system to be able to manage outbreaks as they happen. If we must go above this phase, we must increase that budget to 2 digits. That was the recommendation. So we know what to do. It's just that the government is never ready to do what they have signed to do. Once this is done, and not just done, but the monies allocated and actually expended on what it was allocated for, even the less than 4% budget that is given to healthcare, half of it is also stolen and misappropriated. So this is where we need to start from in tackling the Nigerian healthcare system decay.
All right, Ehi, then thank you so much for speaking with us.